So you're gonna have your diluent up here, and then you're gonna have your medication on the bottom. You're going to take this, you're going to slam it down. It's going to take this plunger and put it into the medication. And it will look like this one. So it'll come down, and your little eraser will be down in there, and you'll mix your medication.
Shake it up.
Yeah, and then you'll just swirl it
dissolve
around.
it.
The top will have a little plastic part that you're going to pop off, and it will let you see that bullseye.
Yeah.
See that little stopper right there, little bullseye. You're going to have a syringe and a needle. I would make sure to look at the needle sizes. Some of the pharmacies will give a bigger gauge needle to draw up the medication, and a smaller gauge needle to administer. So I would just make sure
I
that
think that's what they did on the one that we picked up.
okay.
Right?
So I would just make sure that you're not administering it with an 18 gauge, because that's huge and it would be very, very painful.
Thank you.
Okay.
That's very good
Draw it
stuff.
up.
So yeah, you would
draw it
put
with the
on
thing.
yeah. So you would put on like
The
bigger
like
needle.
green
Maybe
or
it'll look
something.
like this or something. And you'll put it on, and then you'll put it in the stopper. So I'll show you this way. You're gonna put it in. The stopper in the middle. You're gonna turn it upside down. Your dose is the full dose. They're gonna always give you a little bit extra.
Because the extra doesn't matter. Too much is not as bad as too little, right?
Correct, but they're gonna always give you a little bit extra just so you can get out all the medication that's needed. Yours is going to be 2 mils. This is 100 milligrams per 2 milliliters.
Okay.
So unfortunately, it is not like an EpiPen or a glucagon pen. Maybe one day they will be nice to us and do that for us. And we can do it together and be rich. And then this is just a sample, so I don't even think I have a full 2 mils in here. But anyways, you're gonna pull it up. It's only 1.5, but you're gonna pull it up. You're going to have it say 2 milliliters.
Yeah.
It says 1.5 right now. And then you are going to find a muscular part of your body. So it's kind of like a flu shot. So you could put it in your arm, or if you were a baby, right, we usually put it in your chubby legs. So it's on the side of your leg,
Yeah.
and then you're gonna pinch it. In emergency, standard practice, right, is to clean the area. You're gonna clean the site to make sure it's nice and clean before injecting. In an emergency setting, sometimes you don't always have time to do that. But best
if we
practice,
can put alcohol wipes.
yes, they
in.
should give you alcohol wipes. So then you're gonna have the side of the leg,
Okay.
your muscular part, because it's going to be intramuscular. You're going to pinch it. You're going to stab at a 90-degree angle, administer the medication, pull straight out, put your finger on the site, and you're good to go.
Awesome.
And when you say go, you mean go to the hospital.
Yeah,
ER.
you're ready to go.
Because in this, it should be like emergency. I just
Yeah.
passed out. We
Yeah.
just did that. We need like.
Yeah.
Follow-up care.
And then it's like if you're vomiting and you're needing to give this, then it's like, I need to go to the hospital because I need IV fluids.
yeah, to get
Okay.
regulated so I can stop
Yeah.
throwing up. And
Yeah.
Okay, so in those cases, it should just be, can I take my medication? And if I can, that's always the best.
Yes.
If I can't, then that's when this is
Yep.
used. Awesome.
Okay, do you want to try?
Yeah.
Okay. And let me